New weapon to fight COVID and the flu at the same time may be on the way.
Today, Pfizer and BioNTech announced they've gotten fast-track approval from the FDA for their vaccine against both viruses. Here to answer your questions is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Dr. Wilds, nice to see you. Tell us how it helps to have one vaccine for both.
John, I think having a combined vaccine is really very important because you, in essence, simplify the immunization process. You, in essence, put two respiratory therapies in one, which potentially could increase the vaccine uptake, especially this season where we are seeing a lot of cases of COVID and flu together so far. I think having increased vaccination rates would be a big difference for us.
Doctor, great to see you as always. We're in the early stages here, but we have seen science move pretty fast in the past couple of years. So what questions will you, as an infectious disease specialist, most want answered before this new shot is even available?
So, Maria, the most important things that I look for, one, how effective is this vaccine going to be? Is it going to prevent hospitalization and deaths? What about the safety profile? Another thing that's really important to me is what's the racial makeup of the study groups and how do people respond? I think there are a lot of things to consider, but these are just a few things that I'll take a look at as I'm assessing what the FDA is going to present to us.
And doctor, let's talk about prevention for a minute. This week, the CDC said that some communities might want to consider recommending mask usage again with a combination of course, COVID, flu, and RSV on the rise. Do you think that's something we should be thinking about here?
John, as we face the tripledemic of RSV, COVID, and flu, I think it's really important for counties that have significant cases of COVID and flu to really go back to the drawing board and look to see whether or not it's time to recommend well-fitted masks to individuals, especially those who are immunocompromised. But I think it's not only the mask. I think I want to use this opportunity to encourage those who have not had their COVID booster or their flu shot, also go ahead and get that. Continue to practice good hand hygiene. And I can't stress enough, if you're sick, please stay home so you don't infect others.
Great advice. Dr. Wilds, always appreciate your insight.
Yes.
Thanks so much.
Be well, doctor. Good to see you. And to our viewers, if you have any COVID-related questions that you would like our experts to answer, just email them to ask@wcvb.com.